And that request portal that you're talking about, is that open source?
Sure, yeah.
Because as you know, it works pretty much with open source software, but I feel like when you say open source, you rather have an idea of a researcher, maybe somebody who works in R&D, but not necessarily a medical doctor, for example, or a patient. But they are also a big, important, essential part of the health data research infrastructures. So I'm wondering, what's your experience of using open source solutions for in this context for these infrastructures? And if you have seen any resentment, or everybody is actually open and happy to use open source solutions?
Well, as I also alluded to with Data Biosphere, I think that more or less the default by now, certainly for core infrastructure, is standard-based and also open source. And open source has a lot of advantages, right? So there is the traceability, it's the ease of adapting to it, that no license costs, so it's much easier to structure or to start, for example, from an academic group easily with playing with the tools without having to commit to a license budget or things like that.